genetic disorder I have decided to research is autism. Other names for this are Asperger's syndrome and pervasive development disorder. As of now, scientists are unsure as to how it is caused. However, they believe there are numerous factors, such as lead, pollution, and heredity. Lead can cause fetuses in the womb to become diseased or warped and cause their DNA to be damaged. Pollution in the air and water can do the same thing. Heredity means that it can be passed on. For example, if someone has a brother or sister with autism, it is quite likely that they will have a child with autism. This disorder is usually detected by parents when their child is showing no signs of development by age 3, which, by the way, is a criteria for the disorder. The parents then take this child to a specially trained doctor. This doctor will then run a series of tests on the child, determining whether it has autism. Usually, these tests including having the child do things that normal kids can do, such as saying their name, or something similar to that. And if they fail at the simple tests, they have autism. The primary symptom of autism is lack of development. For example, a 5-year-old may still act like a 1-year-old, with a limited vocabulary and sometimes unable to walk. People with autism hate loud noises and bright lights, and get very disoriented and annoyed when they are exposed to them. Furthermore, people with autism have a very low skill level of social interaction and can be very annoying when in public. Autistic people also usually cannot hold a job very well, and usually do only mediocre in school at best. Autistic children also are good at doing something repeatedly, many times over, such as using a computer or other device. Today, about 1 in 88 people in the United States have autism. That amounts to approximately 4 million people. In the past 2 decades, autism numbers have increased by about 15 to 20%. Boys are far more likely to have autism than girls. About 1 in 54 boys have it, whereas only about 1 in 252 girls have it. A rather large difference. A tragedy, this disorder does not have a cure. Once someone has it, they will live with it until the day they die, which, by the way, is about the average lifespan for a normal person. Autism does not affect the number of years a person lives. However, there is something of a treatment. Autistic kids can go to therapy and work with people who will help them gain life skills and help them be more normal. This therapy sometimes works, but sometimes it doesn't. It appears that usually it doesn't, which means that kids will not have made any remarkable improvement, meaning they will act the way they do forever. Some interesting research going on is that scientists are taking the brain tissue of dead autistic people and trying to find a cure with that. They examine the substance and try to find out exactly what causes it. With this information, they can try to prevent it and maybe even find a cure. Unfortunately, very few autistic people donate their bodies to finding a cure, which means it will be very difficult to find one, and it won't be here anytime soon.